Hello, everyone. It's great to see a lot of you here on our very first Medical Realities virtual global grand rounds. I'm your host, Professor Shafi Ahmed, and I'm going to be spending the next hour or so looking at various areas of healthcare practice with an expert in that field. We have a big team. We're working for 4 weeks who've launched our platform, and it's covid.medicalrealities.com with an amazing amount of resources, videos, training tools for everyone who wants to understand and learn about how to treat patients with COVID-19. So Professor Lakhani has been a practicing GP in Leicestershire since 1991. He's actually one of those rare individuals who's combined an active career and a successful career as a GP, also with high profile leadership roles. He was the president of the Royal College of General Practitioners in 2017. He also worked on the palliative care part of the NHS, really promoting how we should be managing patients at the end of life, and we'll share that experience with you, of course. He's a trustee and chairman of the National Council on Palliative Care from 2008 to 2015, and also he's won many awards for what that he's done on the national front. He qualified from Dundee University back in 1993, now has been a GP for 26 years.
So yes, I'm in Leicestershire, and it's a nice evening. It's a Monday evening, the sun is shining, and I've been working today remotely, mainly in general practice. So I'm very pleased to be able to talk to you about this pandemic and what it means for general practice and the future of care. I want to state very clearly to everyone, this is a big moment for us. Whether you're a doctor, nurse, a member of the public, this is a big moment for everyone. I'm reminded of Yeats's famous phrase from his poem, all changed, utterly changed. And I'm proud of the work that the medical profession has done, right from the students, trainees, the returning doctors, junior doctors, general practitioners, consultants. They have really stepped up to the plate. And no one who's needed treatment, to the best of our knowledge, who's needed critical care, everyone has been able to receive that. So I think we can be very proud of what's happened. And you know, it is striking what's happened because huge changes have been implemented in a very short space of time, principally by remote working. I know many people, consultants and GPs, have said to me, they do not wish to go back to the old ways or business as usual. So this is a unique opportunity to pursue a new normal. And in my talk, in my brief talk just now to set the scene, I'll be asking the question, what is the new normal? Not just for primary care, but also for healthcare systems. You know, people will ask, where were you in 2020 during the pandemic? What did you do? What do you remember? What was your contribution? And I think we all have an obligation to use this momentum to change care for better. But with this crisis, we have now approached, in a sense of clinical freedom to practice. Only a few weeks ago, I would rarely prescribe antibiotics by phone. That's not regarded as good practice. Now, most management of patients with COVID-19 chest infections who are mild to moderately ill are managed remotely. So these things are good to hold on to because looking ahead, we have to do three things. The restoration of services that have been suspended, like cancer surgery, the recovery of routine services and undifferentiated presentations in general practice, and a reset. How do we do this using the new normal that I've described? Just remind everyone, the key to restoration, recovery, and reset is safety. So COVID testing, blue and green zone cohorting, and PPE, and hopefully a vaccine soon. So it's really important that we look forward to having a strong primary care system that's geared for endemic COVID-19 infection, but also meets the new challenges. Now, I want to say that before this, we weren't entirely happy with our model of care. General practice is a jewel in the crown of the National Health Service, but I detected this when I was president of the college, that the general practice profession wanted change itself, wanted more autonomy, flexible working, control of workload, and avoiding the damaging effects of burnout. We know that we want to do more for our patients. As a working doctor, I can offer more diagnosis and treatment to my patients. And there was concerns about the culture of medicine. It feels oppressive to be a doctor with complaints, regulation, and mistakes. Doctors make mistakes because they're hungry, they're angry, they're late, they're tired, they're overworked, and they don't get enough support because of too much demand. It's a condition and situation that's often been described as the hamster healthcare. So the hamster wheel where doctors just keep running faster and faster to stand still. And of course, the scourge of modern medicine is overdiagnosis, too many investigations. I've noticed recently that the number of blood tests and investigations has reduced rapidly. And of course, there are people here who do need diagnostics, but a lot of the routine work has stopped. And finally, doctors, particularly in family medicine, but in all branches of medicine, looking at the future of primary care. Firstly, we must embrace the fourth industrial revolution, which is innovation, digital, artificial intelligence, wearables, home monitoring. This is a very, very powerful contribution to healthcare. Eric Topol has written that if we systematically embrace the fourth industrial revolution, we could spend longer with patients. Imagine if we had a sense of the genomic data, the phenotypes, the lifestyle, environmental factors. All the hard work is done for us by the time we contact a patient. I think we need to learn from COVID-19, for example, things that haven't gone so well, such as care homes, the big problem with personal protective equipment and the death amongst healthcare workers. I love my work, and I love my work because of continuity of care and relationship with care. What does that mean for when we work remotely? And does this act to the detriment of people who don't have access to the internet or whose English is not first language? But I very much hope that this is a big moment to review the regulation for doctors. So I call today for a major look at regulation of primary care. What does good look like in the future? And reduce the bureaucratic demands for general practice. And finally, to make sure that new models of care, new ways of working such as telemedicine are remunerated and included in the contracts of general practitioners and of consultants and everybody else. But like I explained, healthcare is becoming more complex. Patients have legitimate needs. We have exciting developments in technology, in genomic medicine, in cancer treatments. There's so much more that we can do for people. And who better than an expert medical generalist, a specialist in family medicine, to hold the ring for their patients. And I think we will have new models of care now, which will mean that GPs' leadership will be so key to the NHS.